Lubbock Mayor Dan Pope with us. Appreciate you joining us this morning. How are you doing?
I'm doing great. It's good to see you, Tori.
Yeah, it's very good to see you. Now, I wanted to talk with you today because your city, Lubbock, has been having great success getting your community vaccinated. So really, I'm just curious what you attribute that success to. What have you been doing over there?
Well, we have a great team. We started the last week in December. We have one major, mass vaccination clinic. It's at our convention center. We've closed it down. That's all we're doing there. And everybody's pulling the same direction. I think we're the size of the community where we can get that done. It's led by our health department with a great bit of assistance from Lubbock Fire and Rescue. But our hospitals, both of our big health systems have thrown in. Texas, we couldn't do it without the Health Science Center at Texas Tech, particularly the medical school, and nursing school. That the students have helped a bunch. Lots of volunteers, nurses that have come out of retirement that are, spending their days at our clinic putting vaccines in people's arms. Churches are helping. It's really, when you have a bad day, it's where you want to go because you see hope and you see people really excited. And so we learn. We keep getting a little bit better. Early on we realized that some of our parts of our community maybe weren't getting reached like we wanted them to. So we partnered with United Supermarkets, the Lubbock-based sort of West Texas, not all West Texas, that's where they grew up, supermarket chain and great community partner. And they we're sharing some of our vaccines with them, and they're able to go into some of their supermarkets that get at parts of our population that maybe are less mobile or are less likely to come to a mass vaccination clinic. And so that's helped also.
I assume some of those rural counties around you are also coming into the vaccination hub in Lubbock.
Yeah, they are. We follow the governor's order pretty closely, and that 1A and 1B from a qualification standpoint. But we want to get the vaccine in the arms of Texans, and certainly my interests are those that live in Lubbock. But we run the health department for the county, so all of Lubbock County. But we're vaccinating quite a bit of there are quite a few other West Texans. They rely on Lubbock for it's the hub city. They rely on us for a lot of their healthcare in normal days, and certainly for other things that we provide. So it's pretty normal for them to come in. We and some of them don't have much access to the vaccine. So we're providing a life-saving opportunity for them.
What does your vaccination distribution system look like in terms of how people sign up, how you choose who gets it, and things like that?
Yeah. So we're using we use our Select a Seat application, which is what we normally use to sell tickets for events in town. We're using that. We've sort of modified the app online, and that's how you schedule your appointment. We still do have take some appointments by phone. We know that some of our citizens aren't internet savvy, but that's the main way we schedule it. We give folks just a bit of heads up as to when the signups will begin. It's become our cadence is we're running vaccination clinics on Tuesday, Wednesday, Thursdays, and Saturdays, and we normally start the sign up on the Monday, right before, the day before. It's worked out pretty well. I mean, you've got to have a fast finger, and some folks get a little frustrated that they weren't able to get in the first week, but we don't have quite as much demand today. Those slots they weren't going quite as fast as they were early on, but we're still, able to use our weekly allotment and get vaccines in people's arms.
Are you pretty close, at least in Lubbock, to getting the vaccine to all 1A and 1B eligible people, or do you know where you're at in that?
Well, that's hard to say, just because we don't know, that the number of people that won't be vaccinated. We still have demand for 1B, so I would say no. I think the numbers I saw earlier in the week, based upon the state's estimates, had us at maybe 40% of the 1B population. So if you believe what you read, that somewhere around 2/3 or 70, people will take the vaccination. Maybe a little higher in this age group or this population. We still have some work to do, and so a big part of what we're doing is communication, trying to use different voices that come from different parts of the town. We created a vaccine ambassador program. Our health department stood up, leaders from our Hispanic community, leaders from our African American community, folks that have been vaccinated that will talk to their friends and let us do some social media and it's pretty basic stuff. It's I don't think we had to call Silicon Valley to come up with some or Madison Avenue. It's just blocking and tackling, and we do it over and over and over. It's a lot of common sense, and I think it works well. I'm really proud of the team that is doing the work.
And a couple more quick questions before I let you go here.
Sure.
What does the wait list look like as far as from when someone registers to when they're able to get the vaccine?
Yeah, see, we don't do a wait list. You can sign up for your vaccine for that week, and if you don't get in, you get a chance to sign up the next week. The wait list, we felt like there were some issues that went along with that. Think about last week. What do you do with the folks who were on the wait list last week when you have bad weather? Think about a wait list when your supply ramps up significantly, and you might be having people that have been waiting for a month, and you might have supply to put it in the arm of someone who never was on the wait list. So just a real simple, we're going to schedule for 1 week at a time and do it that way. Now, I know that the hospital does do the United supermarkets and their pharmacies, they have used a wait list, and it's been effective for us then to reach out to those, citizens that have been on their wait list that shop in that store in that part of town where we want to make sure we're getting the vaccine. But from a city perspective, we don't do a wait list.
Where do you go from here and even getting more of your city vaccinated? What efforts are you putting in place?
We think that we're planning on running our mass vaccination clinic through April. So we've got 60 more days of that. We hope that by that point, there'll be enough supply and enough places that our citizens can be vaccinated, that the mass clinic is not an important part of the equation. However, we reserve the right to pivot on that, and if we need to keep running it, we'll run it. We're committed to getting vaccines in the arms of Lubbockites. We've talked about saving lives and livelihoods both since this began, and our economy has functioned relatively well under the dark clouds of this pandemic for nearly a year now. We're not changing our course. We want to get people vaccinated. We want our community to be safe. We want to start living a life that we recognize.
All right. Well, Mayor Pope, I appreciate your help today in talking about this. We appreciate having you on.
It's good to be with you, Tori. Have a great day. Thank you.
You too. Thanks.